Hi there, it's great to be here with you. In fact, it's really, really good to be here with you because when I'm kind of sitting at home often, thinking about the kind of work that I try and do and the same kind of work that you're doing, I often start to think to myself, am I kind of crazy to believe in all of this stuff? And it can have an effect and an impact and help to improve the world a little bit. But when I come to events like this, I see there's lots of other crazy people who kind of think the same thing. But, you know, I think we're not so crazy. I think the evidence and history and time and technology is with us now. It seems to me we know a lot about how to create great social programs that help people live better lives. But one of our problems, it's not a problem, it's, you know, and I've witnessed it the last couple of days, is you're all such lovely people. And you're also modest about what you're doing. And I think one of my colleagues from Australia, Jess Pete, says we need to be louder and prouder about what we're doing. So what I want to kind of spend the next 20 minutes or so talking about is applying what we know works and maybe stopping some of the stuff we know doesn't work so well and being a bit more assertive about that. Okay. So let's see if we can make this work. Yeah. Okay, well, this is me. As you've probably already noticed through my accent, I'm not an American. I'm from Britain. I'm English. That's not my mum, by the way. That's the Queen. Wish it was. We have a good tradition of social marketing, behavioural change in the UK. We're always ready to share that, but we're also very keen to gather ideas from other places and incorporate them into the kind of national social marketing strategy that we have. And so it's been great to listen to lots of the great presentations, and thank you, Rescue, for organising this event. This is me. Of course, like you, I like to find out about my audience that I'm speaking to today and try and tailor what I'm doing and saying to you. So a few little facts about America that I discovered in my research before I arrived. I know Rescue like to use, you know, cultural stereotypes to predict, but I found this set of lovely big data that says that voting intention can be very accurately predicted by musical preferences. So thanks for all the music, America. And I'll be watching the data as it comes in for the next election. Unfortunately, San Diego, you're still into pop, apparently. You need to get with it. Grime is the new thing. Stormzy is the person you want to be listening to. So, just a few facts about yourselves. 1 in 3 of you are obese. If you've got $10 in your pocket and you don't owe any debt, you're wealthier than 15% of all Americans. Inequality is a big issue in this country. And what's the deadliest job in America? Riskiest job? Being president. A lot of them get killed. Okay. You also, I know you don't like paying your taxes, but you don't seem to mind your big corporates in the tech field, Global Northeast, not paying their tax. I love all the, you know, we've had some great stuff from these companies over the last couple of days. They do fantastic work. They make the world a better place. But it would be nice if they paid their taxes, especially in my country. And just my last kind of fact about America. I mean, America, you know, we love you because you do lots of great stuff. You're hugely creative and you're risk takers. We like all of that. And I discovered that 9 people last year named their first child Cheese. I just love that. I love cheese as well. Okay, so I've only got 20 minutes left. You know, the Yale Communication Study is great, you know, data about how to do good lectures and all that. That's why we've got a 20-minute session here. What we know is that an intelligent audience like you can concentrate for about 15, 20 minutes, and then your mind starts to wander, okay? And what you start thinking about is sex, usually. Okay? So when I see that kind of glazed look come over your face, I know time's up, get off, Jeff. Okay? So I'm going to be doing a little bit more than TEDing, but that's us. This is my new book. It's out. It's the only ad. Please buy the book. It goes into some detail. I am a serious academic and practitioner. I'm not just this kind of stand-up person. This book is out with my colleague Ross Gordon, second edition. It goes into in a lot more detail with lots of case studies, including American ones. So please take a look at that. Okay, what we're going to cover is why we need to change the way that we work, because people are opting out and pushing back against traditional ways of influence. Something about, and I think this is at the core of what we've been talking about the last couple of days, creating social and personal value, and some of the trade-offs that have to happen between those two things. Some examples of that and what we need to do. So I'm going to go quite quick. We have big, messy challenges we have to deal with. 2 weeks ago, here in San Diego, the American Economics Association had their conference looking at why, for the last 3 years that we have data for America, your life expectancy rate is actually going down. Okay, that's pretty remarkable. And the economic impact that is going to have on your country. Big, complex issues. We also know there's a lot of social division, not just in your country, in many countries and regions. There's lots of pessimism, there's lots of anger, there's lots of fear out there. The age of deference is over. Trying to persuade people to do stuff from a position of authority or power is not going to get you very far these days. This is some American data. Do you trust the government most of the time? 1964, 2012, the change. Is the government run for the benefit of people like me? Okay. Who do we trust? Still, you look at down the bottom of this chart, politicians, journalists, and so on, and the trends are down. When we get towards the top of the chart, luckily professors, of which I'm one, only 20% of what I say is bullshit, okay? The rest of it you can trust. But this is an indictment, and it's a factor we need to take into consideration when we're developing social programs. Okay, politicians don't care about people like me. Scary numbers. Okay, and people are pushing back all over the world against what they consider to be power elites, particularly people who don't feel they have benefited from the economic developments that have happened in many countries. So people are different, they're pushing back, they're not going to have it anymore. Put up your hand if you were born between 1950 and 1970. Okay, about 20%, I would say. Your generation LX, you're the charm generation, you've got most of the capital assets. You spend more money on fashion and luxury goods than younger people do. And basically, you want it how you want it. You're very demanding from non-public sector services. Put up your hand if you were born after 1970. Okay, you're even worse, or better, because you're digitally connected with each other. And if you get bad service, you tell other people. We expect good, great service from anybody, and that includes government and not-for-profit programs. Okay. People want to be part of the solution going forward. We want to be part of the solution. We don't want to be dictated to anymore. People are telling us, if you look at lots of the mega data, a number of things. They're saying, I don't believe you. So just giving people facts from a position of authority is not going to work. I don't trust you. They don't trust what we're saying, with good cause in some instances. Listen to me now. Put effort into that. I want to be in control. Your job is to help me. Your job is not to fix the problem. Okay? People know a lot about how to fix stuff if we listen to them. This is expert design. This is user experience. Okay. More connected people through social media, huge benefit, empowers people. push back. Well done, youth. Keep pushing back. More demonstrations, more protests, please. People are also disengaging. Okay. What we know from data around the world and experience of effective social programs is that leaders need to operate differently. We need to recognize the falling trust and put more effort into engaging and working with and through the people that we're seeking to serve. We need a new politics of the common good, more scrupulous politicians, but also more active citizens. The Pope has recently talked about artisans of the common good. Each of us has a contribution to make to making society better, and we need to recognize and realize that. And, easy examples like using roundabouts and aggressive drivers v. more considerate drivers can make a big difference. Okay. Anybody know who this is? Any economists in the room? This is Frederick Hayden, Nobel Prize-winning economist. And what he says is policy fails when it's put together by a group of experts and tried to be driven down through the system. Policy works when you engage people in the development, delivery, and evaluation of the program. Okay. OECD recently talked about if you want effective, innovative government, you need to be engaging with the citizens more, encouraging them to be involved in creating the solutions that we all want. So it's not about expert-directed model anymore. It's about power of citizens model, citizen-centric model, planning, delivery, evaluation. Central to this, I would contend, is the creation of value, personal and social value. And the marketers amongst you will know that there are many dimensions of value. We need to understand what kind of value propositions will actually move and motivate, assist and help the people that we're seeking to serve. It's the way human beings operate. Okay? We are people who like to trade, exchange. We believe in reciprocity. You give me something, I'll give you something back. We like to cooperate and co-create. This is going with the natural flow of what it is to be a human being. Not telling people to do stuff, do that, people don't, or they push back, work with them, get their ownership, then they're likely to be involved and change what they're doing for the better. We also need, this is Robert Lusch, unfortunately died about 2 years ago. He's kind of father of service dominant logic. And what he says, it's about not just about tangible benefits, it's about the intangible benefits, sense of well-being and so on. This can create social cohesion, or it can create divisions in society. This is New Zealand. Hi, people from Christchurch. This is, why don't people ride, Christchurch had a big earthquake. They're redesigning the city and getting more active transport back. Why don't people use the buses in Christchurch? Well, from some data that I saw, what it says is they think the buses are complicated, won't take me where I want to go, they're not convenient, they're slow, they're not safe, they're smelly, they're dirty, and they actually call the buses loser cruisers. Only people who ride these things are the poor, perception, and students, okay? I live in London. In London, everybody rides the bus, okay? It's perceived to be cheap, fast, efficient, convenient, and safe, and socially acceptable as well. Okay, so what I'm saying is we need to co-create value with people, work with and through, not do stuff to people anymore. So co-development, co-delivery, so on. This is Gummison. Again, the marketers amongst you will know he's the father of what we call relationship marketing. And what he's shown in countless studies in the commercial and not-for-profit sector is the longer the relationship that's established between a provider of a service or a good and the people that consume it, be that a social good or a commercial good, the better it is, the more profitable it is, more effective it is for the organisation, but also the more beneficial it is for the recipient of that good or service or support. Okay. And we know how to do it. We've got great understanding now, through lots of years of research and practice, about how to engage in things like participatory design to create services that are loved and owned and engaged with by members of the public. There are great examples out there. This is, if you work on the obesity issue, this is a great example of a user-centric, whole systems approach to tackling the problem of obesity with good results. That's the EPOD program developed in France and now spreading around the world. Okay, so just to kind of make this a bit more concrete, some examples of both value creation and value destruction around the world. And unfortunately, some of our work destroys value rather than actually improving or creating it. So, how responsive are our public services really? Okay? Do they match the best responsive commercial services? I would contend not always. Okay? Getting better maybe, but not always. Work to be done. This is an example from the Netherlands. This is a bus stop. When you sit on the bus stop, your weight is displayed on the screen. I would contend that this is not going to create many people eating more healthily, losing a bit of weight. Shaming is not a great tactic, as we've heard. This is a more extreme example of value destruction in the name of social good. This is Honduras, where if you take the emergency contraceptive pill, you will be locked up. Okay? So this can go to extremes. You have seatbelt legislation here. In Turkey, they also have seatbelt legislation. It's the law that you should wear your seatbelt. Nobody wears their seatbelt in Turkey. The police don't wear their seatbelt in Turkey. The police do not enforce the seatbelt legislation in Turkey. What people do, this is a taxi driver who drove me from the airport in Ankara. What you'll notice is that there's a little clip in the car. And I said, why don't you wear your seatbelt? He said, it's dangerous. I'll die if there's a crash. I'll be burnt to death. I won't be able to get out of the car. I said, okay, why do you put that thing in there? And he said, that's to stop the car bleeping at me, because that's annoying. Okay. So people will get around laws and legislation that they don't agree with and consent to. If you want to use the law to improve public health, and it can be very effective, you need to have popular consent for it. Any Greeks in the room? People of Greek ancestry? No. Greeks are smart. They don't have any money, as you know, after the financial crisis, so they don't go to the market and buy something to clip in. They just put the seat belt around the back of the seat and clip it, and it does the same job. They think the same as the Turks. Okay, some examples of how we can create some positive value. We heard previously yesterday about parks and recreation. Some negative reinforcement, application of restrictions on people's freedoms is perfectly acceptable and should be an integral part of public health programs, providing, again, there is public consent and support for them, and they're proportionate. We can incentivize people. This is that Norway has a really good recycling record, and one of the ways that they encourage that is by giving people incentives, financial incentives, to recycle goods, and they also make it really easy. This is a great example of, in every supermarket store you would go into, there's a way of redeeming your old bottles into these machines, and you get some money out. A great example from Australia, and we've got some people from Australia in. If you drive down the Bruce Highway, which is a long straight road, and if you want to get from Brisbane to Cairns, it takes you about 5 or 6 days of just going straight at 50 miles an hour. Lots of people fall asleep and have crashes. So about every 100 yards along this highway, there's a sign that says, don't fall asleep you'll crash, you'll die, and variations of that message. After a while, you stop reading them. Okay? But occasionally you come across a sign like this one that says driver reviver. And if you pull in to this stop, there's a little kiosk, and there are volunteers there serving you free tea and coffee as you've given a break. This works. This saves lives. People like it. It adds value. Okay? The community volunteers like it too. Okay. There you are. Free cup of tea. So one of my current favourite ones from Bologna. Any of you have been to Bologna? Any Italians in? Probably not. Bologna is a crowded city. Congestion. So what the city authorities try and do is encourage people to walk or cycle or take the bus into town. If you do that, it's tracked. You get some points, and you can exchange those points for ice cream, beer, or theatre tickets. Okay? Or you can pool them collectively and in your local neighbourhood, and then the city authority give you money, and that can be put into charitable causes of your choice. Okay? This is the last one. This is an example from China. People are very creative about developing value propositions for themselves. Most of you, I'm sure, are doing your step counting on your phone or your watch, smartwatch. In China, that's also a big thing, especially sharing how many steps you've done with other people. So this is a little $1.50 cradle you can get in the market that goes bump, 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 whilst you're sitting at your desk eating, burritos or whatever. And so you get your 10,000 steps racked up for you with no effort whatsoever. Okay, so summary. What do we need to do? Well, my first point is don't worry. Be positive. We know a lot about what works, how to develop programs and plans that can be effective and efficient and ethically sustained as well. We know a lot of stuff about what we shouldn't be doing. So we should be positive and proud of where we've got to. We now need to start implementing this stuff in a way that's focused on helping and working with citizens to create value. We don't live in a post-fact world. We live in an increasingly data-rich world that helps us track and learn. Okay. Facts, data, and evidence don't save the world, but by God do they help. Okay. If you haven't read this book, read this book. Okay. This will make you feel much more positive about the state of the world. The world is getting better by most measures that we have. We know a lot about what to do. We have agreement globally through the UN about where we need to target our efforts, and the people are generally with us. This is what the data and evidence and experience tells us we need to do. Drive our programs informed by data and evidence and insight. Focus on engaging with citizens and creating value for them. Have a systematic plan with clear objectives and learning and continuous progressive improvement. Use a full toolbox of interventions. Don't rely on just one kind of intervention, a full toolbox, and work for co-production across sectors and between silos. Silos can be good, okay? I like the idea of smashing silos. Some silos do need to be smashed, but most silos are not going to go away anytime soon. I think it's more about building bridges between silos and connecting them up more than just smashing them down. We need, I think, finally to change the current narrative. Often when I'm kind of reading reports in the popular press and on online, the narrative runs something like this. Regardless of topic, could be environment, could be health, whatever. It's a disaster, it's an emergency. It's too complex, and people can't be trusted to do the right thing. We don't know how to do it, but everything must change. Well, this is a cry of despair, it seems to me. So we need to develop a new narrative. And I think it should go something like this, based on the evidence, data, and experience about what we know works and what doesn't. It's complicated, but it's not impossible. We know a lot about what to do and how to do it. People are a fabulous resource. If we work together across sectors to create value for everyone, we can do it, bit by bit. So what I'm saying to you is we need to move away from this kind of expert-defined, problem-owned situation to one that's about working with citizens, through citizens, creating value for them. And the model for this is not tell, sell, and control, where we've been in the past, and some people are still operating. It's more about social value creation and a focus on these kinds of elements. And again, you've seen example after example over these last couple of days about how we can practically apply some of these new approaches to creating social and personal value. Finally, we need to encourage citizens to step up and enable them to do that, give them the forums and the voice to influence the programs that are developed and delivered. So, people should be encouraged and supported to be engaged in the selection, development, evaluation and learning of all programs. The small game here is to run better and more effective health promotion type projects. And you've learned a lot, and I've learned a lot about how to do that better over the last couple of days. But that is the small game. The big game, I think we're all engaged in, is changing the way our organisations view the world and what they're there to do. It's a strategic question. And it seems to me our organisations need to be focused on creating value with citizens. And if we're not doing that, and our programs are not reflecting that, it seems to me we're not applying what we know works. So the big game, and I'd encourage you to engage with it, is to think about how you can help to revitalise, refocus the organisation that you work in. And for me, and this is the last slide, if you operate in this way, my experience and my observation is that it's a powerful and personally rewarding way to work, and it's absolutely at its core a more democratic way to work. It's about respecting our fellows. Thanks so much.